Go ahead, ma'am.
Good morning, everyone. I'm Dr. Prinka Bajaj. I'm a fertility specialist at Oasis Fertility, Banashankari, Bangalore. So today we'll talk about endometriosis. So first, let's know what is endometriosis. See, the inner lining of the uterus, it is called as endometrium. Now, if this endometrium gets deposited anywhere outside the uterus, like on the tubes, on the ovaries, or behind the uterus, or anywhere else in the pelvis or outside, it is known as endometriosis. So, what are the symptoms? Most common symptom in endometriosis is pain during the periods. Most of these patients, they come and complain that they have very severe pain, which starts even 3 to 6 days before the period starts, and it continues throughout the periods. Another thing is very heavy bleeding during the periods. Then, pain during passing motion or urine can also happen. Pain during intercourse, especially that happens when these endometriotic implants are deposited behind the uterus. Another thing is infertility, which is that is inability to conceive. So let's discuss about the reasons why and how infertility can happen in endometriosis. See, what happens every month is that some hormones are produced from our brain, which acts on the uterus, and that is the endometrium, to receive pregnancy. But by any reason, if pregnancy does not happen, then this endometrium sheds, like bleeding during the periods. So, whatever changes they happen in the endometrium of the uterus, the same changes they occur in all the endometriotic implants which are deposited outside the uterus also. Because of this reason, the whole pelvis, no, in that some inflammatory condition develops. As a result, adhesions form. That is, the organs start sticking to each other. The ovaries may get stuck to the tubes, or the ovaries may get stuck to the side wall, or it may go and stick behind the uterus. Also, sometimes because of these adhesions, the tubes may get blocked also. So these all are one of the reasons. This anatomical distortion is one of the reasons for infertility in endometriosis. Another reason is that because this inflammatory condition is developed, it also affects the endometrial receptivity. That is, the capacity of the uterus to accept a pregnancy to implant is also reduced. Another reason is if these endometriotic implants are deposited on the ovaries, then every period when you will have bleeding, more and more blood will be deposited on these endometriotic implants on ovaries also. And then they form chocolate cysts there. Now, what are chocolate cysts? These are cysts which are in the ovaries. These are endometriotic implants in the ovaries, and they are known as chocolate cysts because they are brown in color because they have altered blood. So when chocolate cysts are there in the ovaries, it affects the quality of the egg and hence the quality of the embryo also. So if the egg quality and hence the embryo quality is poor, it again leads to infertility. Also, it can affect the growth of the egg and the release of the egg from the ovaries. That is, ovulation is also affected. See, endometriosis is a progressive disease. It keeps on increasing. The severity keeps on increasing. Even if you remove the chocolate cyst, you remove the endometriotic implants, release the adhesions, still this disease is not permanently cured. So we just have to try to control it. And how can we control it? The best way to do that is to conceive as early as possible. Because if you conceive and you get pregnant, your bleeding will be stopped. Because every month when you bleed, this endometriosis stages will keep on increasing further and further and getting worse. Now, how can we treat endometriosis? See, the treatment of endometriosis, it depends upon several factors. First is the age of the patient, then the symptoms, then how the ovarian reserve is like. That is whether the egg number is good enough or whether it is declining. Then the status of the tubes, whether the tubes are healthy, they are patent, they are open or not. Another thing is the severity of the disease, the stage of the disease, whether it is minimal or mild stage or it is moderate or severe stage. So, depending on these factors, we have to decide upon the line of treatment. If you are of young age, your ovarian reserve is good, the tubes are healthy, there is only minimal or mild endometriosis, and your male partner also, the sperm is good. In that case, for 3 to 6 months, you can try naturally also. Or in some cases, we advise IUI, that is intrauterine insemination, in which the husband's sperm is washed and processed in the lab and it is directly deposited inside the uterus. But if the age is advanced, or if the tubes are blocked or unhealthy, not patent, or if your ovarian reserve is declining, or if the stage of disease it is moderate or severe, or in case your male partner also has some problems in the sperm, in that case we advise for IVF or test tube baby treatment. In minimal or mild endometriosis, laparoscopy can also be done to remove off all the endometriotic implants, to clear up the adhesions, to correct the anatomy, the relationship between the tubes and the ovaries. And that really improves the chances of getting pregnancy even naturally or through IUI. If you have moderate or severe disease and there are endometriomas, that is, there are chocolate cysts in the ovaries, if these chocolate cysts are very large or if they may come in the way of getting out the eggs, in that case, even before IVF, these chocolate cysts need to be removed. But if you have to undergo a lab for removal of these cysts, then the IVF should be done as early as possible after this lab procedure. Because the more you will wait, again these endometriomas can form and the chances of getting pregnant will decrease. So as early as possible, the success rate of IVF will also be better. See, endometriosis, basically, as I told you, it is a progressive disease. So the most important thing in endometriosis is time. Time is of great essence. The earlier the treatment and the best kind of treatment when it is given, the chances of getting pregnant also increase. So if you have endometriosis, meet a fertility specialist, get yourself properly evaluated, and choose the right kind of management at the right time. Because timely treatment and the right management is the key to success in endometriosis. Thank you. If there are any questions, you can please mention in the bar below. Do lifestyle changes help to cure endometriosis? Actually, lifestyle changes will be of help in any way to improve your pregnancy chances, not only endometriosis per se, but if you will try to reduce, if you are obese, then if you try to reduce about 10% of your body weight, if you avoid junk food, processed food, and eat a healthy food, and also just take some exercise daily, take a walk daily, at least 1 hour of brisk walk daily, a healthy diet, and avoiding of smoking and alcohol, etc. That will really help in improving your chances of pregnancy, whether you have endometriosis or not. A healthy lifestyle definitely helps in improving chances of pregnancy. Is endometriosis curable permanently? See, endometriosis cannot be cured permanently. As I told you before also, there is no permanent cure for endometriosis. If you have a tendency of developing that endometriosis thing, it cannot be removed off completely. Every month when you will get a period, again, their blood will be deposited somewhere in these endometriotic implants. These inflammatory changes will keep on happening and it is a progressive disease. You can just try to control it, conceive as early as possible, get pregnant, deliver, and just keep it under check. But you cannot cure it completely. It can again and again, even if you remove of the chocolate cyst from the ovaries, after a few months or after some years, it can again come. So there is no permanent cure for endometriosis. How do you mentally deal with endometriosis? I know it is very difficult because there are so many symptoms, and if you just keep aside one factor, that just getting pregnant, even if you have achieved pregnancy, still the pain during the periods, the pain during in the lower abdomen all the time, even during intercourse, it is very difficult. But then for that, your doctor can really help you. Talk to your doctor, have some counseling sessions. There are even counselors which are available in these fertility centers. You can talk to them, and that really helps. then accepting first is acceptance of this problem, that you have this problem and then I have to deal with it. You can definitely be treated for it to some extent. So treatment for it, counseling sessions, and talking freely about it. Even there are some groups in which the other people who also have endometriosis, they can share their feelings and they can discuss with you. It really helps in mentally dealing with it. Thank you so much for your time. If you have any doubts, you can call on the number which is given below, or you can also come to our Oasis Fertility. We are here to help you. Thank you.